Good morning, my dear students. Today we are going to discuss about varicose veins examination. I would like to tell you that this is the first video of 3 video series, and this is designed for medical students who are awaiting their first clinical appointment. The aim of this video is to give you the general idea on varicose vein examination. I regret to tell you that varicose vein examination is a bit of troublesome procedure, and a lot of medical students tend to miss certain steps in the examination. Therefore, today I am trying to put the sequence of varicose vein examination into your head. If you get this sequence properly, you are unlikely to miss the steps of varicose veins examination. As for any examination, you have to begin with history. In this brief history, you have to concentrate on 3 aspects. Firstly, you are trying to find a cause for varicose veins in the given patient. So we are going to ask about family history of varicose veins and also about history of deep vein thrombosis. Then you are concentrating on symptoms, complications, or you are trying to pick indication for management of this patient's varicose veins. And there you are going to ask about things that you tend to miss in your examination. Otherwise, it's a waste of time. So you are going to ask about history of chronic ulcers, history of spontaneous bleeding from these distended veins, eczema, swelling towards latter part of the day. Thirdly, you are going to ask about associated conditions. The possible associations are varicoceles and hemorrhoids. You have to pick your questions appropriately to the patient and the situation. Then you have to move into examination of the patient. And the most important thing that you have to remember, the sequence you are going to follow. So first, you will start your examination keeping the patient in standing position, and you will start your inspection from the groin area of the patient, and then you will move down up to the ankle of the patient, and you will have to stop there as you are looking for few more important signs at the ankle, and then you will move upward until you come to the groin. Then you will put the patient onto the bed. Firstly, you will do some important assessment. Then you will start your examination from the abdomen, and you will move down up to the foot, and then you will come back up to the abdomen. After that, you will be doing some specific tests. If you can remember this sequence, it will be very helpful for you to do the proper varicose vein examination. Then we will move into detail of the varicose veins examination. So you need to have a standing patient who was in that position for at least 3 to 5 minutes, preferably on a stage. You will first inspect the groin area of the patient for any obvious saphenous. Then you will move down. Your aim is to define the territory. So if it is greater saphenous territory, distribution is mainly anterior and medial, and also involve the above knee area. So if the territory is small saphenous, you will be seeing varicose veins mainly in posterior aspect and lateral aspect, preferably on the leg. But you may see features suggestive of dual system involvement. In this way, you will move down up to the ankle, and there you are going to look for complications of varicose vein. The earliest is swelling, then ankle flare, then features of eczema, means scratch marks, then hyperpigmentation, then features of lipodermatosclerosis and venous ulcers. So what are the features of chronic venous ulcers? They are usually seen in greater area, but you must remember all ulcers in the great area are not necessary to be venous, and you may see venous ulcers in the areas other than great area of the leg. Other features are they are usually large, irregular margins and superficial, painless. So they are highly unlikely to penetrate through the deep fascia, and they will be having some unhealthy granulation tissue on the base. They are usually wet wounds. Finally, you may see certain type of foot deformities as complications of varicose vein, preferably equinovarus deformity of the foot. Then you will be moving upward. Your main aim is to identify a clearly distended vein to perform tap test. The technique of tap test will be described in our video number 2. Then you will be further move upward, and when you come to the groin, you will be checking for coughing pulse of the saphenous varix. Then you will put the patient onto the supine position, and firstly you will raise the relevant limb to about 45-degree angle, and you will be observed for disappearance of the varicose veins. Failure to happen so is a sign of pelvic masses or arteriovenous fistula. Then you will be starting your inspection again from the abdomen. You are looking for distended veins, primarily 4 tributaries of the greater saphenous vein, but you are more likely to encounter distended superficial epigastric vein and superficial circumflex iliac veins than other 2. Then you will be moving downward, palpating along the greater saphenous vein. You are checking for tenderness and other features of inflammation to exclude thrombophlebitis, and you are also looking for defects in deep fascia or pits in deep fascia, which is a sign of perforated incompetence. In this way, you will reach the foot where you are going to check dorsalis pedis and posterior tibial pulses. Reason is, if there is significant peripheral arterial disease, you can't use certain management options which are available for varicose veins. Then you will be moving upward to check the calf tenderness, again to exclude deep vein thrombosis. Reason is, certain management options are contraindicated if there are features of deep vein thrombosis or deep venous system insufficiency. Then you will be moving into inguinal area, and if there was a wound, you have to check for inguinal lymphadenopathy. Otherwise, it's not that relevant. Then you will be moving to abdomen to do the proper abdominal examination to exclude masses. Then you are left with special tests. First one will be Trendelenburg test. Aim of that test is to identify the level of perforated incompetence. How to perform that test and how to interpret it will be discussed in our second video. Then you have to do the Perthes test to exclude deep venous system insufficiency. The reason for that has been already mentioned. After completing these steps, you may suggest to examine for varicocele and hemorrhoids to the examiner. before concluding your varicose vein examination. I hope you have understood the steps of varicose vein examination. Again, what I want is to remember the sequence of examination. Thank you.